Hello everyone, we're doing module 5 and it's preventing infections. So need to know words, we'll go through those as we go through the units, and the objectives you can read for yourself, they're in the book. So what is, I'm moving myself, preventing infection? Infection is spread by microorganisms. So that's a new word. So they're living organisms that can only be seen with a microscope. And right now we're going to make it simple in that there's two types of organisms, a pathogenic, and that means a harmful one, germs. Non-pathogenic doesn't hurt you. Um, Infection spreads through contact, so somehow an infection, not all diseases are infections, remember, something like diabetes is not an infection. Arthritis is not an infection, but infections are spread from one person to another, or from one person to an object and it could be an animal or a fly, and then it goes back to the person, right? So pathogens, which are pathogen means harmful, um, usually enter the body by broken or damaged skin. So skin is one of our biggest defense mechanisms, but it also goes through our mucous membranes, such as up the nose, the eyes, the mouth. In any kind of open area, it could go, as we talk about later, urinary tract infections in women, it goes up through the urethra. So, and now so next we're going to talk about the chain of infection. How does it go from one thing to the other? And I put a little picture in here. So you'll go over this again and again, chain of infection. First, we're going to start with a germ. There's a germ. So where is that germ? It's usually a bacteria or virus. Could be parasites, but for this class, let's keep it bacteria or virus. Um, so virus, then it goes into some reservoir. It's bacteria or virus. And again, usually it's people to people, but not always. We could get rabies from dogs, um, other uh, other type of diseases through animals. Could be in our food, right? We eat something with salmonella. Could be in the soil where the food is. Could be in the water that you drink. Um, so how do the germs get out? So let's talk about a sick person, right? We call it a portal of exit, but it's just how the germ exits. And it could go out your mouth, your nose, your saliva, right? And with COVID, we're through our mouth. That's why we're wearing masks, out and nose. Could be through your skin. So if you have cuts or you have a draining pussy wound, right, that's draining yellow discharge, could go to someone else. Could be in your blood, such as a lot of diseases, hepatitis B, HIV, hepatitis C. They're all through the blood, and you can't see it. Could be through your feces and urine. So here I just like this picture, but during diapering and toileting. Well, with adults we call it briefs, but it's the feces and urine. Okay, and then germs. So now it's exited. Now we call it a mode of transmission. So let's say it exited in the feces. How did it get to that other person? Or let's say it exited through your nose and mouth. So, in a sense of your nose and mouth, it could be with droplets, you're coughing. That's just, they call droplets, but it's just sprays that you can't see, um, but are a little bit heavier with your pneumonias. Now, the one thing it doesn't have here is airborne. Okay, it has droplets, and airborne's more like COVID and tuberculosis, and chickenpox. So there's not many that have this vi virus. It's so light that it could just go through the air. Usually, in the case of most bacterial pneumonias, it's droplets. They cough, and it can only go 3 feet. So it can only go 3 feet away. Um, but it could also be contact. I'm touching the feces with bacteria in it, um, or I'm touching my phone that has bacteria all over it. Okay, so that's how the germs get around, mode of transmission. Then how do the germs, and remember the other word for germs is pathogens, how do the pathogens get in? So again, skin is a big defense. So if you have openings in your skin, things could get in there. And that's why when people go for surgery, they go in for maybe a heart surgery. They didn't have an infection, but once they cut that skin open, they could get an infection. Um, but we could also take them in through our mouth, like with salmonella, some food poisonings. Any cuts in the skins, it could also go in your eyes, nose, and I'm going to tell you again, the urethra of both the male and the female, but female more. And that's just the tube that the urine comes out. You could get a vaginal infection anywhere where there's an opening in the body. Okay. And then how, so it's gotten out of somebody through maybe coughing. Then how does it get to the next person? And that's where it has to be a susceptible host. As we know, not everybody gets the COVID. And if they do, they don't have symptoms. So they have a good immune system or an immune system that could protect themselves. Um, Others are more susceptible, as they were saying, people over 65, babies, and that's often the case. And they were saying obese. Obesity is a factor with the COVID, right? So it just makes you more susceptible. Um, and that would be the susceptible host. So going back to this, and they're all listed on page 40. So if you ever look at page 40, look at this picture I put in here. And here is another explanation of what those chain of infections are, but I like the picture. Okay, so again, to keep infections away, we want to keep up the body's natural immune system, okay? And we do that, things that could make our immune system not work is stress, poor nutrition, lack of sleep. It tends to weaken your resistance to infection, making you a more susceptible host. The other thing that makes the immune system have build up its own natural defense is vaccines. So when we get vaccines, they give us just a little bit of something that looks like that, like the COVID-19 virus, and then your body builds up its own immune system. Okay, it's not giving you the immune system. That's why it takes 2 to 4 weeks for it to work, right? 14 days. And that's for any vaccine. And then the last is what we could do with our patients is encourage the use of tissues covering mouth, with your elbow when sneezing or coughing. So that interrupts it getting from one person to the next. Okay, in this picture, you could just see someone coughing and how the spray goes out and the germs or pathogens can travel if they have pathogens in there. So what are signs of infections? Most of these are pretty common sense: fever, chills, red or hot skin, nausea, vomiting, lack of appetite, but change in behavior is number one with the elderly. So they can even get confused, like very confused. But at first, it's just those subtle, they're just not right. And then maybe a little confusion or agitation or restlessness, but they're just not their self. Always think infection. Pain, swelling, discharge like a pussy, drainage, or diarrhea. So the sooner we detect that there's a problem with a possible infection, then we could stop them from giving it to someone by not letting them transmit it and clear up the infection. Of course, it takes a team, so they might have to get on antibiotics through a doctor's office. Practice. So what do we do to decrease infection? We say practicing medical assess of sepsis, and it's really just the clean technique. And honestly, you do that in your kitchens and bathrooms all the time when you clean up. So medical asepsis is procedures to decrease pathogens, which is germs, and the main ones are hand washing, 20 seconds, um, clean your surroundings, with the cleans 99% of the bacteria. Lysol wipes, things like that, good personal hygiene on you, and make sure you're using precautions when need be. And we're going to go into that one next. First, let's do hand washing though. So we're constantly washing our hands. A test question will be, what's the number one way, single most important measure for infection prevention? And it still is hand washing. Um, so hand washing before and after your work shift, before and after meals, before and after resident contact, before and after toilet use or after toilet use, after you sneeze, cough, blow your nose, after handling bedpans, feces, specimens, anything that might have body fluids on it. Ooh, excuse me. Um, and and after handling soiled linen, so you have to watch when you're changing someone's bed. And every time we wear gloves, before and after we put the gloves on, we should wash our hands. Okay, we did hand washing, but let me emphasize some things. Always for at least 20 seconds and using and including your wrist. Keep your nails short. Your nails have to be short because that could harbor germs in there. And again, when we're washing, keeping our fingers lower than our elbow. So those are little reminders. Okay, so mostly we're doing medical asepsis, but let me tell you the other words that you may hear. Sterilization will only be in a hospital, and that kills not just the bacteria, but the spores, which is like the eggs. So it kills everything. So once it's killed, nothing can start growing again. Has to be usually is done under high heat and pressure. Okay. Um, but disinfecting, we do that all the time. Here's these disinfecting wipes, right? We do that all the time. So it's a chemical that kills most of the bacteria or pathogens. It never kills all. I also want to talk about hand hygiene using the sanitizers. So these are great, but again, they're similar to this in that they don't kill everything, right? It always says kills flu viruses, kills 99% of the bacteria and viruses, okay, but it doesn't kill 100%. And so whenever you're changing someone's briefs or working where there may be feces or even bacterial feces, always wash your hands. So you should always wash your hands then all the time anyway, but there is one disease which is made by a bacteria, Clostridium. This doesn't work at all for it. Okay, it has to be soap and water and friction for 20 seconds. Okay, and it goes by C. diff. It's Clostridium difficile. But just remember, if you're ever working where there could be feces in the bathroom and it could be microscopic, wash your hands, meaning that you can't see it, but it could be there. Okay, now we're going to also, because this started when there were blood-borne pathogens, right? And that was with the HIV. When that first came up, now there's a lot of medicines, but people were dying. It's kind of similar to COVID, people were just that were usually healthy were sick. And and you couldn't see anything. So that's when in 1988 they started what was called universal precautions to stop the spread of deadly bloodborne pathogens. And there were bloodborne pathogens before that. Hepatitis B, before that vaccine came out, healthcare workers would die from hepatitis B and many would get sick. So in 1996, they kind of switched it over a little bit, but it became standard precautions, meaning that we are going to think that everybody may have an infection. I don't care if they're a 4-pound baby up to a 110-pound elderly lady or man, that they can have an infection that we can't see in their blood. So we're going to use personal protective equipment for contact with all blood and body fluids. So that's usually just wearing gloves. Now, if we think we're going to get sprayed in our face, we're going to wear a mask and goggles, right? But it's most of the time it's wearing gloves. Now, sweat doesn't fall in that category, but when we say blood and body fluids, let's go through. any teardrop, like saliva from or drainage from our nose, saliva from our mouth, any urine or feces, any blood if it's coming out, if we have openings, any kind of, if we have an infection with drainage, that would be blood and body fluids. Everything's included except for sweat, so just know that. And then we have to watch that there might be blood on some things that are sharp. So besides precautions with each person and all body fluids, but sharp objects such as razors and needles can have blood on them too, or body fluids. And and lastly, bed linens could have body fluids on them that we don't see. So before we change a dirty bed, we want to wear gloves. But let's go through bed linens. First of all, if they're clean, we're going to wash our hands before using them. We're going to avoid touching the linen with your clothing. Remember, I said that's why that person's knee that's on the bed, that's not good for infection control. We're going to wear gloves to handle linen that's soiled with blood or body fluids, and we usually don't know. So you could always wear gloves. And then when we're, oh, I went, so pretend this pink sheet is a bed, towel is a bed, and it's dirty linens, and here's the dirty stuff on it. That I'm going to roll this away from me, but also I'm going to contain all the dirty stuff by rolling it up and then putting it into a dirty linen area. Okay, so and then we're not supposed to put linen on the floor, so we're gonna put it in a hamper, but we often use plastic bags, and it really then you could tie up the plastic bags and it also contains the odors. And then once you work with the dirty linen, you're gonna take your gloves off and you are going to wash your hands. So that is the basics of infection control. Okay, glove and oh, okay. So with gloves, let me go on to gloves. You know, we have to make sure that the gloves don't have holes in them, and we're always going to wear them to protect ourselves from blood and body fluids. Okay. Um, and whenever, so the thing with gloves, you might go in to do patient care. So, and I know this is going to sound gross, but it's to emphasize it. You put on gloves, right? You wash your hands, put on gloves. You change someone's briefs. Well, you have to take your gloves off, wash your hands before you go and do face care or mouth care. Okay, so it's not just wearing the gloves with one patient, it's the different areas of the body. Okay, I'm going to refer you to watch the videos on how to take the gloves off, starting with the palm of your hand. Um, and then the next, I want to talk about face masks because there is no video on that. But, you know, before you put this on, you should wash your hands. However, remember, if you've been wearing this for a while, right, and it's over your nose and mouth, you shouldn't be touching it here to take it off. So let's say you take off gloves or you're not even wearing gloves, right? You wash your hands before you touch this. You really should be taking it off by the straps, okay, and not pulling it off from the front. Um, Okay, we, as a caretaker, you probably won't have to wear gowns. However, in these times of crazy COVID and some of the PPE that we were wearing just to protect ourselves, you may. And this will be in the a video of taking the gown off. Again, the PPE is your protective equipment, so you're afraid that you are going to get infected. Just so you know, there's other reasons to wear gloves when someone's on reverse isolation, but for caretaker, you're not going to do that. And that is not rare, but that is not 99% of the cases, even in the hospitals. Okay. And I'm going to refer you again. There's pictures, and I think it's just easier to watch someone take the gowns and gloves off. Okay, there is a thing where and we know here it's called isolation in your book, but isolation is keeping people who have transmissible diseases like COVID away from other people. The other name for this now is transmission precautions. Okay, so the old-fashioned word was isolation. Now we call it transmission precautions, trying to stop the transmission of one infected person to another. However, a lot of times it's separating people. As we know through COVID, it really is isolation, and people are depressed and having a hard time with it. And I couldn't imagine having someone die alone in the hospital because of that. Um, so it could be due to contact droplet or airborne disease. It doesn't matter. They're put in a separate room. And generally, because you have to wear gowns, gloves, and masks, people don't go in and out of there because it's hard to do to put all the gown up and mask and then take it off. So try to be prepared if you ever go in there. You probably, as a caretaker, won't, but let me just go through some things because people get depressed, and that is for sure. So you could have people that are kind of self-isolating themselves, even in an assisted living. So that doesn't mean that you can't, depending on what it is, can you stay at the door and talk to them, right? Spend time with them somehow if you could wear your gowns, gloves, and mask on. Have family go in there. Just make sure they have the proper attire or gowns, gloves, and mask on because it isolation can kill you too. Okay, so your book goes into hepatitis B and AIDS. So those are two bloodborne diseases. So that's where standard precautions came in. So hepatitis B, again, is the HBV, V standing for virus, HIV, same thing with AIDS, that stands for virus. Um, and it's a virus that affects the liver, okay? And there is no known cure once you get it, but there are vaccines, and those didn't start till 1986. Before that, people died, healthcare workers, with this. So, and it spread through infected blood, and that blood could last like 7 days on a needle. That's why even if there's like drug addicts and stuff, and they're leaving their needles in the park, that one can live a long time, the hepatitis B virus. AIDS cannot. It's like 20 minutes and then it's dead. However, if it gets in your skin somehow through maybe contaminated sharps like razors, you could get infected. And so that's why you want to get your vaccine. Now, just so you know, there's a hepatitis C, there's no vaccine for, and it's spread the same way. So even if you're vaccinated, there are other diseases you could get from that. And you could also get HIV, which is the human immunocompromising virus. Um, and it's the virus that causes AIDS, okay? Which is a life-threatening virus. Well, now this human, I have a hard time, immunodeficiency virus, there's medicines. They never developed anti a vaccine. They tried. However, there's a lot of different medicines that are making people live with it. And I heard just lately that there's one that may even cure it over time, but I'm not sure about that. So, but it's not a death sentence like it was in the 1986. Um, Okay, so but HIV, there is prevention, and just know that you could get it from others if your blood gets in contact with their blood. So it's usually with infected blood sharp objects over here. Oh, so other ways that people could get it though, sexual contact, blood transfusions, although if the blood is infected, but they do screen it. Puncture wounds with infected sharp objects, cuts or open wounds, mucous membranes, contaminated needles and syringes, and infected moms could give it to their unborn babies. Okay. So again, people with HIV could be carriers for life and they may not have symptoms. Um, okay, so the early symptoms of a HIV infection is usually kind of just you're a little under the weather, may have coughing, fever, swollen glands, could get diarrhea, but it's usually like flu type symptoms. And then the advanced symptoms go later. Treatment is definitely changing things. So again, the survival is terrific now, as you can see on TV commercials. Anyway, but we still want to prevent ourselves from getting it. So treat all blood and body fluid as if contaminated.